Preventive medicine physician Dr. Daniel Angerbauer offers valuable insights on what makes a healthy gut microbiome, signs that may indicate an imbalance, and practical lifestyle tips for achieving and maintaining a healthy gut.
What makes a healthy microbiome? Is it having the right good guys, the good strains, or not having the bad guys? And again, it goes back to balance. So you could have all the right good guys, the right beneficial strains, I guess is the more scientific way to say it. And if they overgrow, you're going to be you're going to be having GI issues or SIBO, or small intestinal bacterial overgrowth, or something like that. Um, there's also we've talked about bacteria so far, but there's also yeast that are in the gut, and some can be helpful and some can be harmful. Again, in the right balance. There's also viruses that are a part of this picture, and may not be all bad the way we think of viruses always being bad. So there's just this complex dance of all of these different organisms interacting with one another. And I think that's what makes it challenging to say, oh, this person, you need this specific strain. And if we just give you this strain, that's what you need and you'll get better. Um, we're just, I think, a long ways away from being able to do that. So outside of treating disease or even specifically trying to prevent a disease, what are the things that we can be doing to just have a healthy gut, to optimize our mood, our brain function, just for daily life? There's a whole bunch of things on that front, and I guess we can just start with lifestyle because that's the always the best place to start and seems to have the biggest impact. So nutrition in general, and that's going to look like whole foods, less processed, less sugar, and it's a little hard to generalize, and I'm biased because I see a fair amount of people with GI issues. But generally speaking, those are plant foods, whole plant foods that have fibers, polyphenols, prebiotics, probiotic foods, sauerkraut or yogurt, kefir, things like that, kefir, however you say it. I don't know how to say it. Um, that's a good start. So you've got the nutrition piece. Everything that you think of in terms of health has an impact on the microbiome. So exercise. And interestingly, not too intense, people that are training or undergoing a triathlon, for example, there seems to be that level of intensity seems to actually disrupt the gut microbiome and that barrier that we were talking about. So, again, everything in balance, but exercise seems to be helpful. Sleep has, as you could guess, sleep has an impact on the gut. Stress, again, you've got those nerves coming from the brain that go down to the gut that say, we're stressed and there's a threat and fight or flight versus, okay, it's time to calm down, relax, regenerate, restore. What signs or symptoms, what clinical presentation would a patient have to say, ooh, I need to maybe work on my gut or my microbiome? To get nitty gritty, what I would say is everyone should be having at least one bowel movement per day. That bowel movement is ideally, and people listening or watching should look this up. It's called the Bristol Stool Scale. It should ideally be about a Bristol 4, which that's the consistency of the stool. So not too loose, but not constipated and too hard either. Um, and you should not have to sit on the toilet for very long and do a lot of straining to pass the bowel movement. That's kind of like my poor man's microbiome test. I don't know if, anyone has specifically researched that. And then the other thing I would say is if you're having a lot of gas, bloating, indigestion, abdominal pain, especially abdominal pain that's relieved by a bowel movement, reflux, any of these GI symptoms could be connected to some sort of dysbiosis or issue that's going on in the gut. So that's kind of the way I think about it in terms of frequency of bowel movements and frequency consistency, as well as other GI symptoms. If you are pretty much minimal GI symptoms, having a bowel movement every day, it's generally Bristol 4, your microbiome is and your gut overall is doing pretty well. And taking a probiotic or something, you might not have that much to gain versus someone on the other end of the spectrum, which is having a lot of issues on one or both of those. They often go together. Then you can probably bet that if we did a, fancy stool test, that there's going to be some dysbiosis in the microbiome.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.